Wow, and so far I can see, you guys can't see yet, we'll post it as soon as we close out the poll, but it looks like 68% are planners and 22% are coming from public health, 2% from the nonprofit field, and 7% other. Such a mix. All right, we'll give it one more minute as people call in. It looks like we're still about the same spread for the attendees. We'll show the results in just a second. All right, we're going to close the poll down, and I'm actually going to share this poll so we can see what it looks like. So we came in at 70% planners. We have a fantastic showing, 18% in public health. We don't have any planning commissioners this round, so we'll have to work on that for the next one. 2% from the nonprofits and 10% others, so it's really exciting. So I'm going to go ahead and hide the poll for you guys. It is really a pleasure to be here today with you. So my name is Dr. Elizabeth Baca, and I work in the Governor's Office of Planning and Research. We are doing a ton of work in the healthy planning space, and so we will be hosting these series over the next year. A couple of logistics. We actually are recording the session, and that's one is we're putting them up on the website so that people can go back to these later on if you have colleagues or people that you'd like to share this with. The lines are muted across all of the attendees just because we have a large group. But that said, we really encourage questions. So on your text box on the left lower side of your screen, as questions come in, as thoughts come in, please send those in to us. We'll be taking some breaks between our our presenters, and we would love to share those with the audience. Also, if there are technical problems or you're having a hard time signing in, the best number to call is directly for GoToWebinar, which is 855-352-9002. As I mentioned, this is a series that we will be hosting over the next year. We have a lot of topics coming. Actually, our next one is going to be on climate and resiliency and how healthy planning can really play a role. So stay tuned. It's going to be an exciting time with some really great innovations across the state and beyond. And none of this would be possible without this amazing group that really has helped both provide vision for what these trainings can look like, as well as content, potential speakers, and formats. So I can't thank everybody right now, but I just want to say a big thank you to them. Let's see. And it looks like the screen's not showing, so let me just go ahead. It is? Okay, perfect. Want to make sure we say thank you to all of these folks. The other thing is that we have two sponsors. We have the California chapter of the American Planning Association, which is sponsoring this event, as well as the Health Officers Association of California. Just as a disclosure, none of the speakers on the leadership committee or speaking today have anything to disclose, and there will be a survey at the end of the webinar. We would love everyone to fill it out, but particularly if you're applying for credit, it's one of the requirements. So based on our sponsorship, we're able to provide continuing medical education credit as well as American Planning credit for AICP. And to make sure to fill that out by 10/26, there'll be a survey that comes up at the end of the webinar today. If you don't have a chance today, then there will actually be a follow-up email as well. The other thing we're doing, since so much of this work really happens in partnership, is we have a LinkedIn group that is a place to share ideas, to share announcements, for funding opportunities related to this, and also to share, thought leadership on these issues. So particularly after today, if there are questions that we still see coming in, it would be great to be able to continue some of that conversation there. I wanted to just take a minute and say that in the news, this is a huge issue. There's so much emphasis around healthy planning, and the Surgeon General, Dr. Murthy, is actually called for a walkable movement to really help create walkable communities, and I think everyone who's joining today really plays a part in that. As far as our learning objectives, I won't read them all out to you, but I think a lot of the ideas behind bringing these cross-sector teams together is to think about what works for effective cross-sector partnership. It's really about how you have different examples with integrating data, when thinking about policies, also about really the partnership and thinking about funding. So you'll hear a lot of that today. We have some amazing team members, and it would probably take me 20 minutes to introduce everyone with their full bios. We have Dr. Olivia Kassiri, who is the health officer for Sacramento County. She's done amazing work both in Uganda and here in Sacramento. She's done a ton of cross-sector work and has been on the team with Judy Robinson, who is the Principal Planner and Sustainability Manager for Sacramento County. Also a leader with over 25 years experience who has just been phenomenal to partner with. From San Francisco County, we actually, unfortunately, Megan Weir was unable to join last minute, but Leilani Schwartz is going to be standing in for her, and we are so appreciative. And she comes very highly recommended. And so she'll tell us a little bit more about herself. And Mari Hunter, who's a senior transportation planner with the San Francisco Municipal Transportation Agency, and has really been the lead on a lot of this work in Vision Zero, which we'll hear about. In Orange County, so Amy Buck is just really fun to work with as well. I've worked with her for a while. She's done a lot of work with the healthcare agency to develop programs to really think about making local jurisdictions healthier, to improve walkability. She's also a member of the California Conference of Local Health Officers and Administrators leadership team for chronic disease prevention. And Trav Inchonesi, which I'm hard with languages, but he'll correct us, is a research analyst with the Orange Care Healthcare Agency and has done a ton on health promotion, particularly using data, and I might recruit him for some other projects that we're doing. So on that, I'm actually going to go ahead and hand over the controls to our first team presenting from Sacramento County. And they will be taking over controls to share all of the great work they're doing in Sacramento.
Are we on?
You are on. I'll let you take it away.
All right, great.
Thank you, Elizabeth, for this opportunity to present at this webinar. I'm Judy Robinson, Principal Planner and Sustainability Manager and Design Practice Sacramento team member for here in Sacramento County.
And I'm Dr. Olivia Kassiri, Public Health Officer and also a team member. So this slide will be familiar to most of the people in public health. This was a result of a needs assessment that we did. And no surprise, when you look at the leading causes of death, you have cancer, heart disease, and stroke. One thing also to note that's important is that the preventable risk factors for these top causes of death are lack of physical activity, poor nutrition, and smoking. And what we found as a solution to address especially the lack of physical activity is looking at active design.
So this is where Dr. Kassiri and I met. She was just hired as the county's public health officer, and she and I were engaged in issuing park prescriptions. Dr. Kassiri wrote park prescriptions to tens of thousands of Sacramento County residents, and we engaged her in a Strategic Growth Council grant that we also had at the time to advance transit-oriented development along one of our major corridors in Sacramento County. And we were trying to, we were doing a number of public workshops connecting the health benefits to transit and walking.
Then we got an opportunity to participate in the National Leadership Academy for the Public Health, which is a leadership training sponsored by the Centers for Disease Control. So I asked Judy to put together a team, and I'll let Judy talk a little bit about that.
So It was kind of fun. Instead of telling them what it was about, I just said, hey, how would you like an all-expense-paid trip to Atlanta? And everybody was in. And the team members that are showing on the screen, we're just missing Dr. Edie Zussman. She's a Sutter neurosurgeon. But we all went to Atlanta and had a wonderful bonding experience. But this is a cross-sector team that I was also using with the Folsom Boulevard Corridor Project, where we had representation from Adrian Engel, who's a transportation engineer, and Terry Duarte was the executive director of a nonprofit, Walk Sacramento, and we pulled in our metropolitan planning organization, Monica Hernandez from SACOG.
And what really helped about the trip is that it helped to congeal the team and also create trust and closeness. And as a result of the trip that we took to Atlanta, we actually met with a team from New York City who shared with us the active design guidelines, and then that's when we knew what we wanted to do for our project.
We knew that we wanted to do work around health and the built environment, but how do we narrow that down? And so New York City helped us land on active design, and you see the 4 elements that we focused on that really was being able to shape what the physical environment was that would really help to activate and influence human behavior for folks to be more active, and in turn then get healthier and start addressing a lot of the chronic disease problems that you saw on one of our first slides.
One of the big things we did at the beginning was to put together the big picture, because this really helped us in deciding who are our stakeholders, what kind of priorities we were going to focus on. And of course, we don't expect you to be able to read this, but this is just to point out that it's really important right at the beginning to spend the time to think about all these things, because as you go through the process, it helps you to remain focused.
So I found it really helpful for Olivia and I to strategize how do we approach some of these things, you know, through local government. What's the best way to make some different advances, you know, get some traction and really move initiatives forward. And so what we started with was looking at policies that were already in place and and putting a health lens on it, so that we could start already taking credit for things that we were doing that supported health, but maybe wasn't specifically addressing health. And that was really our first step for success, and then jumped on opportunities as they arose. And during the course of our leadership program, one of the first things that came up was the county was updating its housing element as part of the general plan. And so we had an opportunity to look at the work that we were doing and add new policies that really did put a focus on public health, safety, and livability through community design and the built environment. We were able to then insert active design and really bring it to a forefront of advancing healthy communities, and in turn then it was adopted by the board and became part of the overall general plan policies, which then gave us the policies that we needed to advance active design in our work. So shortly after the housing element was adopted, then the county undertook updating the zoning code and development code. And the zoning codes implement policies of the general plan. And this is where active design started. There's the icon that's on your screen, the little walking person with the heart, was introduced in our zoning code and development standards as something that relates to, it's a policy that identifies this as active design, and this improves and advances health. It also serves to implement active design, to inform and educate the users of the code, and then also makes them easier to find and incorporate into project design. And then lastly, at the most basic ground level, are the design guidelines. We wrote some new design guidelines that were specifically focused on active design that were incorporated in the overall countywide design guidelines. The little icon is used like a healthy food menu item to identify all those policies that advance active design. And then we wrote an appendix document that further explains the state of health that's in Sacramento County, and it informs what active design is, what it looks like, and how when it's incorporated into project it improves the public and the community's health. So Olivia, How do you build a team?
Take a trip. I think that was an important thing that we did that really helped to build our project. And also the important thing was also to have a cross-sector team, because we all bring our different expertise to the table in the projects that we do. The other thing was also to leverage opportunities as they appeared, and we were fortunate that at the time the county was updating critical policy documents, and that gave us a project that we could work on. Once we finished our project, it was a one-year project, we felt that it was important for us to continue our work, so we moved Design for Active Sacramento under the umbrella of Walk Sacramento.
And people heard about our work, and our team grew. We extended our team with additional experts that added to the credibility and diversity of our team. That's been very, very helpful in our work. So in being successful in some of our strategies, we want to identify that you really need a champion. You really need other folks that are like-minded, where you have intersections that you identify that you have in common, and then you build on those. We were fortunate that we had over 12 community partners, different organizations throughout Sacramento that were also instrumental in helping us build support. They wrote in letters of support to the Board of Supervisors, emphasizing the importance of health in policies and using the icon to call attention to that. Our cross-sector team, comprised of experts, brings great credibility to not just our work, but how we also can spread and bring the work to others. And what was important is using our expertise with different audiences. Throughout the course of, and still today, we continue to teach each other each other's languages, and what does that mean, and help us to even further grow our understanding. But up in the upper left part of the slide, Dr. Hauser did a presentation to the county's Community Planning Advisory Council training program. We had over 100 people in the room, and she did a presentation on why is a doctor here, and talking about all the health problems that she can't treat, but because of making good land use choices and changing the built environment, we can, in fact, improve the public's health. Dr. Edie Zussman addressed a whole bunch of transportation planners back in New York City, and also brought a whole health perspective in a way that folks could really understand how to integrate that into their work and the importance of that. So, you know, leveraging all of these relationships, leveraging the knowledge and the expertise is really important, but it was also important to have fun.
And we did that. So this is what the team looks like now. We added a number of individuals, including my mentor, actually two of my mentors, the former health officer for Sacramento County, and also Dr. Mark Horton, who was our advisor during our project and decided to stick with us, and he also does mentor me as well. So as you can see, we do have quite a number of people on the team, and it is varied. We do have several doctors on there, but we also have a civil engineer and also someone from transportation.
Olivia, there's way more than just several doctors on that team. So we're, again, thankful to be able to present today, and happy to take a few questions. Thank you.
Thanks, you guys. That's fantastic. Well, as we're bringing up the other team, I wanted to see if there are any questions from the audience. We'll maybe work in a couple of questions. The one thing that comes to my mind, I know that you guys are actually just got a special grant, so you're going to be expanding within Sacramento and including more teams. Logistically, what's worked, and how do you keep track of everybody when you're working with that many colleagues?
It can be challenging, but I think us being able to work with Walk Sacramento as a nonprofit, and them being able to make sure that we were able to keep track of the different partners, as well as use the opportunities that come, especially with the grant funding. I think that really helped us a lot. And again, having people who are looking out, and Judy's been a big part of that, looking for different opportunities where we can share the information.
Yeah, and I think that's great. And what I mean, is there any advice where there are times when you didn't necessarily have funding, but you had a lot of will? Like what, when there's not funding, what are, I know a lot of local jurisdictions are struggling with that. Do you have ideas about how to make it work in that situation?
Actually,
yeah.
when we started, we did not have the funding, apart from the fact that we got the leadership opportunity from the CDC that paid for us to go over to Atlanta, but otherwise none of us had the additional funding to start this. It was just people coming together and having the passion to work on the different issues and finding an issue that we could work on together. Judy, do you want to add to that?
Yeah, we leveraged our passion and some time within our own jobs, but a lot of our free time. All the work that we did for Sacramento County around all of this work, we had no funding for, which is probably it's one of the important parts of the story. The good news now is that we do have grant funding to be able to work with the cities within Sacramento County, and then also through another Strategic Growth Council grant in SACOG, we're able to grow the work throughout the Sacramento region. But I think our story really demonstrates there's a lot that you can do when you take advantage of and when you look around to see what the opportunities are and how do you leverage those. And we did that.
That's great. And someone asked about the grant funding. I think you covered that. Another person wrote in and said, when you don't have the funding, ... that's when all of the fun matters. And so I think that that's a great lesson that you guys have really integrated a lot of fun into your work as well. We have a couple of other fantastic questions. For time, we're going to save those and come back to them when we have all of the groups presenting. But right now, I'm going to actually hand it over to the San Francisco team. So Mari and Leilani, will you guys take it away?
Yeah, thank you. This is Mari Hunter, and I'm going to let Leilani introduce herself briefly.
Sure. My name is Leilani Schwartz, and I'm the Vision Zero epidemiologist. I was hired last December to develop a comprehensive transportation injury surveillance system, and I work at DPH, so in the Department of Public Health, but I'm funded through a MTA work order. So it's kind of a unique position that I'm in.
So we'll just jump in. So the city's policy really is a ambitious goal to eliminate traffic deaths in the by 2024. When we started this, it was 10 years. So we had 10 years to eliminate traffic deaths. And this really started, the city had already adopted a policy about pedestrian safety. And we had a pedestrian strategy, and we were really focusing on that vulnerable population, pedestrians. But then in December of 2013, we had a very tragic month in December, and Sophia, who you're seeing on your screen, was killed in a crosswalk on New Year's Eve. She was one of 6 pedestrians killed that December. And so within a month, policy had been crafted and shortly thereafter adopted by the city, and agency after agency were adopting resolutions to support Vision Zero. So we've been looking to Sweden as a great example of this Vision Zero towards zero death principle, and really starting to, because these collisions are preventable, starting to treat them as preventable. And it's about creating that safer transportation system. And there are lots of inputs to the transportation system, whether it's engineering or enforcement, policy, education, to protect our more vulnerable users, people walking, biking, children, seniors. And again, making that kind of mind shift out of these are accidents and, it's somewhat acceptable to, no, it's not okay. These are preventable, and the city needs to be prioritizing resources to eliminate these fatalities. So again, we've been looking to Sweden. There are a lot of great international examples of Vision Zero type policies, but as you can see, there are a handful of cities across the nation that are have adopted Vision Zero, and you'll see a lot of yellow triangles that are on that cusp of moving into the world of Vision Zero. And so it's nice to see that it's gaining momentum. More and more people are aware. There was the Mayor's Challenge for Safer People, Safer Streets. So recognizing that this is a very transient nation, and you know, people should have a safe experience, whether they're in San Francisco or in Seattle, Portland, Chicago, you know, anywhere that they're traveling. We want to make sure people are safe. So it'd be great to have this taken over, you know, a national trend of safety. So San Francisco is focusing on all those inputs. For enforcement, we have something called Focus on the 5. So using data, we've identified the 5 leading causes of death and injury. And while the police department has their work cut out for them for everything that they are monitoring and enforcing, they really do focus on those top 5 collisions. They're more diligent about those. Engineering, again, we use data to identify where we have our highest concentration of fatalities and severe collisions. And Leilani will talk about that map. But again, it's where we are able to focus resources to ensure that we're getting the most out of our investment. We, of course, want to make the citywide safe, but by targeting these very specific locations where we know we have a lot of collisions, we can really start to cut our collisions quite dramatically right away. Education is another critical input in trying to reach zero. We not only need to, you know, tell people about it, but we need a major behavior shift. Again, kind of that attitude of these are no longer accidents, these are preventable collisions, and a bit of people taking on that responsibility of what are the safe choices that I can make, and recognizing that other people are going to make mistakes. What can I do to make sure that these mistakes don't result in a severe or fatal collision? Policy, we are in a position to do things at the local level, but one that I'm sure is on most people's radars is automated speed enforcement. So, you know, it's about, you know, at the state level and even national level, creating this awareness of Vision Zero so we can advance things like automated speed enforcement, because that would really help, particularly with enforcement. With the limited resources that we have, that's just one more thing that we would be able to do very efficiently. But again, that type of policy, automated speed enforcement, comes from the state level. So we are doing things that we can do at the local level, but it's about building that awareness. So at the state and national level, we can advance even more, even bigger policies to help this effort. And then finally, engagement and advocacy. We work with our key stakeholders, general public, but we also have very active advocacy groups from Walk San Francisco to the San Francisco Bicycle Coalition. And it's working with these groups, and they really did help push the Vision Zero policy from the outset and have been at the table since day one, and making sure that everyone's on the same page and working towards the same goal, so we can be successful in reaching this target of 0 fatalities. So we have a part of that engagement is developing public-facing resources. So earlier this year, in February, we had the Vision Zero 2-year action strategy, and within that, we articulate, you know, the city's goal, as well as a number of action items that each group, whether in engineering, enforcement, education, policy, can take just within the next couple of years to advance the work of Vision Zero. We also have this website, visionzerosf.org, and we put the strategy as well as other key bits of information, the high injury network map that Leilani will walk through in the next half of the presentation, all of the resolutions that the agencies have passed in support of Vision Zero, upcoming meetings just a bunch of resources that the public can look at to get more information, as well as to get involved. We have a Vision Zero task force where all of the public is invited to attend and participate, and so all those meetings are listed there and meeting materials. And then before I transition to Leilani, this is just an article about how we're working towards Vision Zero, and really it is a partnership. That task force that I mentioned is co-chaired by the Transportation Agency and Public Health, recognizing it's a public health crisis and it's, transportation deaths. So it's been great that these two agencies have been able to work together so closely, and has been critical to pull in all the other agencies that are involved to make sure that we're moving forward on the Vision Zero policy.
Okay, this is Leilani. At the core of Vision Zero is public health. We recognize in San Francisco that traffic injury is a public health problem. It is a public health crisis. San Francisco Department of Public Health's mission is to protect and promote the health of San Franciscans. Approximately 30 people are killed and another 200 people are severely injured on San Francisco streets each year. Nearly 50% of people treated at San Francisco General Hospital's Trauma Center are being seen for serious injuries sustained in traffic collisions, which is a huge amount of resources in terms of medical staff and response to patient care, but also just economic costs associated with medical bills. Pedestrian injuries alone account for $15 million medical costs each year at San Francisco General, and 75% are paid from public dollars. So this is the high injury network that Mari mentioned previously, and this network was created analyzing police reported injury data, and this network captures 70% of injuries, which composes 12% of city street miles. And so in terms of targeting resources and prioritizing interventions and traffic safety projects, we know where the most severe and fatal traffic collisions are occurring. Oh, what happened? And so this high injury network can guide us through prioritizing these projects and ensure that we're moving towards projects that are going to have the greatest impact with limited resources in the city. So what public health brings to the Vision Zero team is an equity lens. What this map shows is the area in yellows are communities of concern, and we can see with the overlap of the high injury network in red that, let's see if it, 47% of the high injury network lies in these communities of concern. And communities of concern consist of households living in poverty, low-income neighborhoods, vulnerable populations, which include seniors over 75 years old and people with disabilities. And then also, these are populations that usually don't own a car and are heavily reliant on public transit for transportation, and they're also reliant on active transport. So they're the people that are biking and walking to places. And they are the ones being impacted the most by traffic injury. So to support the work of and advance the work of Vision Zero, Department of Public Health has developed Transbase, which is open source and it's available at transbasesf.org. But what it is it is a Uber database that compiles cities' environmental data with injury data and immediately maps it. There's over 200 variables. I don't know why this. 200 variables in Transbase, and it's very user-friendly, so advocacy groups can query Transbase. Let's say they were interested in senior housing and all the injuries located within a certain radius of those senior homes. They could do a query, and all of the information is at the intersection level. So whatever they're interested in, that data is available, and it's open sourced. So we're really putting the data out in the public where it can be utilized and support Vision Zero work. Oh, and currently Transbase is being replicated in LA as a best practice for prioritizing traffic safety. And so this is a snapshot of Transbase and what it looks like if you visit the website. But this is a heat map showing time of day and the concentration of injuries. And you can see that with this map, it largely aligns with the high injury network map that I showed on a previous slide. But you can see in this Civic Center corridor in the center of the map, that is where the highest injury rates are seen in the city. And this is at a peak traffic volume time. And so Walk First is an example of the utilization of Transbase. It was San Francisco's Pedestrian Safety Capital Improvement Program and is a key step towards Vision Zero. It highlights a collaboration between multiple agencies targeting the high injury network, and data was used on collisions and associated factors to prioritize targeted capital improvements aimed at saving lives and preventing injury at over 150 locations. The team assessed collision patterns that consisted of high speeds, left turning collisions, and matched countermeasures to those patterns. And so as I mentioned with my position, we're developing a comprehensive injury surveillance system. Currently, most jurisdictions around, I mean, this is, I guess, from a national perspective, rely on police data as the sole data source for analyzing injury collision data. It's widely known that police data underreports or doesn't capture all traffic injuries occurring in cities. And so what we're doing to supplement this is we're using police data, but we're capturing trauma registry data from our trauma center, emergency department data, EMS dispatch data, and we're combining and linking these data sources into one comprehensive surveillance system so that we can have a true picture of the burden of traffic injury in San Francisco. And then as part of this surveillance system, we're also tracking Vision Zero fatalities, and they're mapped on a monthly basis on our visionzerosf.org website. And so this is an interactive map displaying where traffic fatalities have occurred in the city. The blue is the high injury network, so you can see that most of these traffic fatalities are falling onto the high injury network. And what a great example this shows is that on a monthly basis, we have a traffic fatality protocol where the police department, public health, and MTA all meet on a monthly basis to review traffic fatalities. And we have a case definition of what constitutes as a traffic fatality for Vision Zero, and all agencies are on the same page when it comes to reporting the monthly number and tracking progress. So, thank you. I guess my contact information isn't listed here, but I'm at leilani.schwartz@sfdph.org.
Thank you. That's fantastic. And I think one of the things that stands out to me is the data. It's a brilliant use of data. We have a bunch of questions coming in, but I'm actually going to hand it over to Amy and Trav. So you guys, I'm going to hand it over. But as we transition, you know, for places that are interested in using data, you guys have been doing it a lot. What's been the biggest reason that that's been successful? You guys have used a lot of data.
Why has it been successful?
Yeah, I think it's so powerful that you've been able to bring in community groups and really rally around the data in a way that's really powerful.
Yeah, well, it makes it very, not to take the humanity out of it, but it makes it very objective. Like, these are fatalities, these are people, but it really helps to point to these statistics, that it's very data-driven and evidence-based. So we've got the data to point us where we should be focusing engineering projects or focusing targeted education campaigns or enforcement. They have, you know, enforcement operations specifically on these high entry corridors. And then we're using treatments, whether in engineering or types of outreach material that has been tried and true. We're using things that have been successful in other places and then implementing those here in San Francisco. So it makes it, we get a lot of community support for something that is, again, evidence-based and supported with the data.
That's great. I'm going to go ahead and hand it over to Amy and Trav. And one of the things that's come in a lot of thought about funding. So I think it's a perfect segue for you guys to share the work that you're doing out in Orange County.
Great. Well, thank you so much for having us today. And we will be talking about funding. And I just want to say, too, it's so awesome to come after Mari and Leilani because just last Friday here in Orange County, we had a forum that focused on active transportation. And our closing keynote presenter shared about Vision Zero, and we're all truly inspired. Trav and I are about to share our experiences as public health staff working with our local jurisdiction on active transportation projects. And as we do, preventing injuries and fatalities is a critical way as we try to inspire greater levels of walking and biking. And we're going to share a case study, particularly Santa Ana, which is a Vision Zero city. So Trav will begin by sharing how he, as a research analyst, provided data supporting the application process for active transportation program Cycle 2 funding.
Thanks, Amy. As Amy said, one recent example of our partnerships promoting active transportation was related to the ATP grant. This past year, we produced a guide to help our local ATP applicants navigate relevant public health resources. The guide was based on a template that was generously provided to us by LA Department of Public Health's PLACE program, which we modified to suit our local needs. The guide included content on the general relationship between health and active transportation, some local public health data sources such as our OC Healthier Together website, which provides a range of public health data at sub-county geographies. Also literature on the specific health and economic impacts of active transportation, as well as a brief overview of the types of services that are available from our local FIT program, which is embedded within the Healthcare Agency's Health Promotion Division and offers really a range of healthy community-oriented public health TA to planning departments, community-based organizations, and other stakeholders. Services like scoping of potential health impacts, public health data, and health department letters of support. So for those Orange County applicants who contacted us for help with ATP, one of the services we offered was a public health profile of their project area. Included in the profile was a basic map of the project as well as its relevant geographic units, which included standard units like zip code and census tract that we use to kind of orient our public health data analyses, but also some units that cities may not have quick access to, like school attendance boundaries. And these were particularly useful because many of the projects were impacting child populations attending schools that were sited actually outside the project area proper. And so considering these populations helped to tell a more complete story. We also included a review of any disadvantaged communities that were near or inside the project site, really as a double check to help ensure consideration of equity and to maximize the score of applicants. The profiles really were designed to specifically provide information inputs into the application's question 4 on improving public health. Section A of the application required health stats on the project's targeted users. So we provided a number of cited local public health statistics on things like general health status, diabetes, heart disease, hypertension, and obesity. And these were generally at the zip code or census tract levels. We provided these as bulleted narrative so they could be easily integrated into the applications. Section B of the application called for the identification and discussion of public health outcomes. So we provided bulleted statements summarizing key impact-oriented public health literature. We also provided data on gaps in the physical activity environment, which could provide additional impetus for the importance of walking or biking within the project area. And finally, the profile also provided detailed information on how the project would support specific priority areas within our local public health plans. One of the cities we provided ATP support to for both cycles 1 and 2 was the city of Santa Ana, as Amy mentioned. We've had a long partnership with City of Santa Ana staff in planning and public works departments on active transportation projects, and the benefits really are clear. First, I think the city has seen what we can offer and now proactively seeks us out for support. And when collaboration and kind of collaborative work brings extra points to funding applications, that's a very real, practical, and demonstrable benefit. And second, our relationships with city staff have certainly been enhanced. We now have open lines of communication where we can call them with a planning built environment question, and they can call us with questions on public health. We've also been asked to sit on various advisory panels, which only really kind of amplifies the value of the relationship. City of Santa Ana staff know and regularly consider public health, and we like to say that our past collaborations have been a part of that. And finally, we've learned so much from them, not only on the built environment and planning, but also on the needs and priorities of the city, which helps us do our job better as public health professionals. And now Amy's going to talk about partnerships in the areas of non-infrastructure programming and policy development.
So continuing along the theme of working with Santa Ana, so one of the things that we do quite a bit is we're big walkability assessment folks, and we use those walkability assessments in a couple of different ways. First, obviously, they provide an environmental assessment, and each year we work with a number of different schools to lead students on various walk routes and get their perceptions of their walk. But what you're seeing in these slides are some examples of walkability assessments that we've done in Santa Ana. Santa Ana is a place where, due to economic necessity, most kids do walk to school. In fact, almost 80%, if not more, walk. However, going back to the Vision Zero example, unfortunately, Santa Ana is a place where we have higher rates of pedestrian and cyclist injuries and fatalities. And so, again, here's another example of one of the assessments in progress. So two things about the assessments. One is obviously it's an assessment, but then it's also a way to engage the community around these issues. So here's an example of one of our assessment findings. And so it's a picture of the sidewalk conditions that were encountered by our students. And the city's been an amazing partner in terms of responding to these kinds of recommendations and alerts that the students have provided. In fact, one of my favorite stories was when one of the traffic engineers actually called one of the students to find out more specifically where the problem site was. Here's another example. This is an intersection in Santa Ana, First Street and Halliday. And you can see the green circle shows where the traffic signal is, and you can see that this is a pretty far distance that a child would need to cross the street. And so this particular intersection was recently prioritized, or First Street, I should say, was recently prioritized through a community planning process for some kind of treatment or built environment improvement that would make it safer to cross. The other thing that we do is, so we're big Walk to School Day people. This year we supported 92 schools in their Walk to School Day efforts. But for us, Walk to School Day is not just a cool day to walk. Walk to School Day, as we see it, is a catalytic strategy for change. At the beginning of the line here, the walk line, holding the sign in the front, is one of our local council members. So it's Councilwoman Michelle Martinez, and Councilwoman Martinez has become a huge advocate over the years for active transportation, and actually recently chaired the Active Transportation Committee for our local metropolitan planning organization. But in this picture, she's actually kind of new to the issue. And then at the back of the line is our Chief Medical Officer. So not only is Walk to School Day a great day to walk, but it's also a great day to engage officials. And then this picture is one of my all-time favorites. It's from our Walk to School Day media event. And so first of all, in my opinion, any day that you're presenting data that's drawn with markers and is on butcher paper is a great day. But what you see here is on the far end is Councilwoman Martinez. She's the one who's holding the sign that says poor driving behavior. And then to her left is who was then Supervisor Janet Wynn, who is now state senator. But so here's two elected officials who are holding data. So is that lobbying? Definitely not. But literally and metaphorically, our students put data in the hands of officials, and this matters, particularly in terms of funding, because then should funding come when you need council to vote on acceptance of the funds or vote on the infrastructure change, there's already been some education that's been provided. So anyway, this has been a way that we found to be really impactful in terms of engaging the community and then also engaging elected officials. And then the last couple of pictures that I'm going to show is how we as the Public Health Department have been able to support infrastructure grants with some non-infrastructure programming. This is an example of, this picture is an example of an assembly that we did in partnership with the Safe Kids Coalition locally, and this was a Safe Moves educational assembly for Walk to School Day. In this particular example, we provided some stickers and some other materials for Walk to School Day. And then we also offer helmets. So by statute, we receive the fine money that comes when kids get ticketed for not wearing a helmet, and then we use some of those funds to turn that around and then buy helmets for folks who might not be able to otherwise afford helmets. And and then we can show up at places like where there are maybe communities in need, and they might be having like a bike rodeo or something like that, again, as a community engagement strategy. So again, for active transportation program or other means too, this is a great way that we can help to support local funding applications in a very genuine way that also, I have to say, starts way before the application announcement comes out. And so in summary, that's really it. For my health department colleagues who are on the webinar today, what we found is coming in with a number of strategies to support local efforts gets us in the door a lot faster when we can be very tangible, like through the provision of the data and the analysis that TRAV provides, or through non-infrastructure programming. And then for the planners who are on the webinar, if you're not working already with your local health department, I hope that you can see that there are many ways in which we can add value to not only your grant applications, but also to your year-round efforts to look at community needs, to engage your community, and to make a difference. So give us a call. That's it.
That's fantastic, you guys. Just because of time, I have a ton of questions personally. We've actually gotten some questions, so I want to go ahead and open it up to everyone. I'm actually going to put your slide on here to show for our question and answer period, because it's adorable. I love the design and the signage. And actually, I was having a conversation with some folks recently, and signage, innovative signage was a really big topic of discussion. And so I think having the kids in the costumes is adorable. But a couple questions. So one came in, and this was actually for Vision Zero. And the question was, what is MTC doing to help take this effort region-wide? So Mari, Leilani, have you guys been working with MTC on this effort?
Sorry about that. Can you hear me?
Yes, yeah, we hear you.
Yes, we've been partnering at the regional level, and we can. Oh, Sorry, I just lost the webinar. Am I still there?
You're still here.
Okay. Yes, we've been partnering at the regional level, and we continue to look forward to that kind of partnership growing, as well as making those connections even at the state level.
Great. And have you, I mean, are there other regional entities that have been looking at what you guys are doing as well? Do you know?
Yes, we have connected with San Jose. They actually came to our last task force meeting, so that was a great partnership. And I know that we look forward, I think I may have mentioned this, that you want to have an experience that is not only at the city level, but regional and ideally national. So would like to have that uniformity across the Bay Area, but certainly when you're traveling down south, we've already connected with Los Angeles. So again, not only at the region level, but statewide and nationally.
That's great. Another question just came in. So as far as this is for Amy and Trav, so Cycle 2 applications that had the public health technical assistance, did you guys track the funding, or even having been on the other side of reviewing applications, maybe comments back to the people who are applying for funds?
So in terms of tracking, definitely we track, and from my understanding at this point, the decisions still need to be voted on. But Santa Ana, in the initial announcement that came out, Santa Ana was successful, and Santa Ana has been successful. We assisted with several others that were not selected, and it'll be interesting to see what the reviewer comments are. But we know in general what we heard feedback from Cycle 1 was that where people lost points, not just in Orange County, but statewide, was that they didn't work with their local public health department or not use public health data. That's worth 10 points. And or they didn't do much in terms of community engagement, which that's worth 15 points.
Okay. Yeah. Go ahead.
When we provide the technical assistance, like for example, the community engagement piece, if that hasn't been done, prior, either by us or by anybody else, if that hadn't been done prior to when the application announcement became released, it's really too late. Like if people are interested in active transportation program Cycle 3, now's the time really to be doing that work.
Right, and I think it's a great resource in that a number of folks I've talked to have said this is really important, but this isn't what we do, and so I think being able to help provide that technical assistance is a great tool from your side. Another question that came in was, this is for the Sacramento team, how is the work in Sacramento affecting development proposals and plans to become more oriented to creating healthy places now that these policies are in place? Are there some specific tangible examples that you can share with the group?
What we found and one of the things that helped is Urban Land Institute, Building Healthy Places Toolkit. A number of different national organizations, we're not the only ones in the world doing this, and so a lot of the work that's being done by the American Institute of Architects and ULI and APA and APHA and countless others, we all intersect on the same things. And so we're seeing in development applications, many of them reflecting more walkability. Especially now, some of the other more landscaping nuances and some of the safety nuances we're having to inform a little bit more, but they recognize that this is what the public wants, and so they are including these in their development projects. So there's still some projects that want to do business as usual, and they lack some of these, and so we provide information on and improvements on how the projects can look better and function better. And one of the cool things too, and I know this is an upcoming webinar, but as we're having these conversations around health, we're also talking with them about sustainability and climate resiliency, because these are all the same built environment tools that are going to help all of our communities be resilient with a changing environment. So. Yep, some developers are more receptive than others, and we're kind of at the beginning stages. We really didn't have much leverage to push on this until we're so thankful that the board adopted these July of 2015, and so they went into effect in August. So we're really just on the beginning stages of this right now.
Great. And looking at the time, we still have a lot more questions. Hopefully we'll be using the LinkedIn to continue to have some of these conversations. There's an excellent point that Judy made about sustainability. So stay tuned for our next webinar, which will be probably in December or January. And look forward to continuing the conversation and continuing to connect everyone. And thank you guys all for presenting and sharing your really and innovative work. So I'd just like to thank you, and that concludes our webinar today, and look forward to the next one.
Thank you.
Thank you.
Thanks, Elizabeth.
Thanks, you guys.